So if you're high income and you're coming on Medicare, you need a different type of advice. You need different specific advice than a person who's of average income or a lower income when you're signing up for Medicare and you're getting Medicare and you're buying insurance to go along with Medicare. So what I'm going to do today is just outline what advice you need and how that advice is different. But before we get into that, I want to go to Tom. I want Tom to share with you why we're doing this video.
Yeah, I mean, we're doing this video because if you have a high income and you make mistakes on Medicare, those mistakes could last the rest of your life. There could be penalties that last the rest of your life. And so you need to make sure that you do things properly to avoid those. And so I'm going to bring up the show notes. You can find these at the link below our video. They're also on our website at cardinalguide.com. Again, we have the board. It sort of goes through here. And then we have it's called Medicare Ready. It's a document that really gives a little bit more detail than what's on the board, but it kind of walks through the main parts that we're going to hit on the board. So if you want a little more detail, you can get those at the show notes. But I would encourage you to watch the video first. We're going to provide some good context around it, but then you can go back to the show notes and just review and make sure you understand everything. So I'm going to turn it back to Hans. We'll get going here, and I'll come back on a little bit later.
Okay, so when we're talking, first question, what is high income? Well, we got to pick a number. Let's just say more than $100,000 a year, okay? And this could even be before you retire, because IRMAA with Medicare, or the extra premium that you pay on Medicare Part B and Part D, uses your income from 2 years ago. So this is something you got to be concerned about if your income even was over $100,000 a year. And then I'm just using that as a general number. If you have a high income, you need different advice. I'm going to point that out. So the first thing we got to do with a person that's in a high income, and really kind of anybody that's going on Medicare when they're turning 65, we need to decide, is this at 65 the right time for you to sign up with Medicare? And a lot of people will say back to me, well, I thought everybody had to sign up at 65. Well, it's not exactly accurate. If you're still working and you're covered by group insurance, that's creditable. That's a whole mouthful. Still working, covered by group insurance. The group insurance is creditable, means the group size is 20 or more, or your spouse is still working and covered by group insurance of 20 or more, and that is creditable. Either one, you have the choice of signing up for Medicare now or waiting till later. Now, as soon as I'm telling this to people, they say, well, what about those penalties? Because most people that are coming on Medicare, they know that if they don't get the timing just right, they're going to get penalized. So if they signed up at 66 or 67 or 68, they're going to get penalized for doing a late sign up, and they don't want that. So what I'm going to tell you is you're a late sign up due to work, there's a form that we can help you fill out that's going to get you in a dispensation from the penalties. Okay, so that's all you need to concern yourself with about the timing. Is the only real substitute that's going to work effectively with Medicare is creditable group insurance from either you or your spouse. That will allow you to delay sign up. Now I'm going to go over some of the things that don't work for delay. Like some people, when they turn 65, well, I got this good plan from the government, or it's ACA, Affordable Care Act plan, that I buy every year, and I'm just happy with that. Can I just stay on that? No. If you stay on that, your Medicare is going to penalize you when you later want to get on Medicare. So that's not an effective substitute. Small group is not an allowable substitute. Like I said, a group of 20 or less it's not creditable. So you can't use that as a substitute. That affects me and my work here. We're smaller than 20. We have group insurance. And when I turned 65, I had to come off the group insurance and get on Medicare. I'm real happy there, but I couldn't use my small group, neither could my wife. COBRA is not an acceptable plug on this either. So if you somehow have COBRA, you're happy with it, your employer is paying part of it or whatever, and you're turning 65, and you say, I'm going to let the COBRA run out, and then I'll get on Medicare. That doesn't work either. So just understand that. Now, IRMAA is delayed. So you're saying, why would I want to delay Medicare? Well, if you're high income and your spouse is still working, you're turning 65, and you can stay on your spouse's group insurance, you may want to do that, because if you sign up and then you have a high income, you're going to hit with this IRMAA surcharge. And I'll explain to you what IRMAA stands for in a minute. So it might be better for you to just delay your sign up till your spouse retires. And then when your spouse retires, then you can go back and sign up on Medicare, or both of you can. So there's an open enrollment period that you're going to get because you're turning 65. And what open enrollment means is from the day you start Part B of Medicare, for 6 months thereafter, you're allowed to buy any Medicare supplement that's sold in your state. This is a federal law, by the way, but any Medicare supplement sold at the same price as perfectly healthy people. You don't have to answer health questions. You're just guaranteed issue a Medicare supplement policy if you're within 6 months of starting Part B. And that open enrollment period, if you delay Medicare because of work insurance, gets moved until you actually sign up for Medicare. Then you'll have an open enrollment period for Medicare supplement. So that's the first topic that I want to cover. Is it the right time for you to sign up for Medicare or not? That's the first decision you're going to make. When am I signing up? Second decision is this is an either or. Okay, when you sign up for Medicare, they initially put you on Original Medicare. That's what you're on. That's what it's called. And Original Medicare has Part A and Part B to it. Part A covers your hospital and skilled nursing. Part B covers your doctor and outpatient. And these days, a lot of the big bills are going to come through Part B. Okay, and Part B is pretty simple. You got a $257, let's call it $260 annual deductible, which isn't much. And then after that, Medicare pays 80%. And then you would have to pay, if you didn't have a supplemental coverage, 20%. And there's no cap on the overall 20%. So in other words, when your 20% paid gets to like 5,000 or 10,000, Medicare doesn't go to 100%. It's uncapped. So that's the reason you need supplemental coverage if you're going to stay on Original Medicare. So you get Original Medicare, Part A and Part B. And the reason I have the word or up here is you got a decision to make. Once you sign up, do I now want to take my Original Medicare and turn it into a Medicare Advantage policy? You say, what is that? Well, unfortunately, this is the way a lot of people learn about Medicare. It's kind of backwards. They don't ever hear all this stuff of signing up or the distinction, and somebody just comes at them with a Medicare Advantage plan. And you see those ads on TV all the time. Some of them had Joe Namath in the past. I haven't seen him lately on any of those. But so a Medicare Advantage policy is you're taking your Original Medicare and you're outsourcing it to a private insurance company. So you're allowing Medicare and the government to take money instead of benefits and assign the money to a private insurance company that you choose. Could be like Humana, United Healthcare, Blue Cross. There's a whole bunch of them. And we sell these too. So we can help you with all of this. But the point I'm trying to make is this is a decision you have to make. And a lot of times people selling these policies or this policy, Medicare supplement, they don't tell you about this decision. They just start explaining Medicare the way they provide insurance for it. So this is a clear decision. After you decide to sign up, you get signed up, then you're going to have to decide, am I going to stay on Original Medicare or am I going to go to a Medicare Advantage plan? And what a Medicare Advantage plan is managed care. So you have to go to their doctors, or you're going to pay more, or if it's an HMO, you can't even go to outside doctors unless it's an emergency. This is managed care, and you're still paying the $185 a month for Medicare Part B plus IRMAA. And what IRMAA stands for, Income Related Monthly Adjustment Amount. It's a big long word, it's an acronym, and it's a surtax. It's an extra premium, mostly on Part B, but it's on Part D as well. And when you're over here on the managed care, you may have outsourced this, but to the government, you're still going to have to pay the $185 a month plus IRMAA. So my thinking is, if you're paying a bunch of money every month for Medicare, why would you want to take it and outsource it to a Medicare Advantage plan? I mean, I'm going to let you make that decision, and we can help you with it. But many of our people that are high income, they stay on original Medicare and they purchase a supplement. We're going to get into those in just a second. So this managed care thing, it has a dental and vision plan included. It also includes a Part D drug plan. And many of these are zero premium. So there might be your answer. Why would you want to do this? What a lot of people are chasing with this is many of these Medicare Advantage plans are zero premium. Now that might be changing in the future, but for right now, there's a lot of them that will let you make this move and you don't even have to pay them and you get all this extra stuff. So I don't want to describe these like they're bad. They're just not that attractive necessarily to people that can afford to do things differently. So I want to get over and explain this option. So I already showed you how to get on original Medicare, what it does. The amount out of pocket is big enough that even if you're very well-to-do, you're going to want to have a supplement to fill in the gaps of Medicare. And once you get a supplement to fill in the gaps of Medicare, you're going to be very pleased with how the two of them work together. So the Medicare supplement policies, I've been selling those myself since 1976. I started writing Medicare supplements in college when I was 18 years old, and I've been in it ever since. And you talk about watching some change, but they didn't even have all this back then. And we would go out and sell people a policy to fill in the gaps of Medicare, and it was $20 a month, $25 a month, and I'd do those repetitively. Along about 1990, the government standardized these policies. So the federal government came out and said, well, if you're going to sell Medicare supplements, we're going to make them all the same. And then each of the states had to ratify this. But this is 35 years going that there's only 10 Medicare supplement policies people like me can sell. And if you get a Plan G from Mutual of Omaha and you get a Plan G from Aetna and a Plan G from Blue Cross, they're exactly the same. The thinking was here to make the policies exactly the same so that people won't have trouble comparing policies. They know they're looking at a G from this company and a G from that company. But they still made it confusing because there's 10 plans, and then they named them the same as Medicare named. You got Plan A, Plan B, Plan C. They could have used Do, Re, Mi or something, but they did this. And what I want to do now is, many of you watching this video are familiar with this. You've looked at a Plan C or a Plan D or a Plan G or a Plan N. And so I want to put it to Tom. I want Tom to come on and show you how you can go to our website and do some shopping for those things without even talking to us.
Yeah, one of the things that if you've looked into this, and I would caution you to do this, like if you just Googled Medicare supplement or Medigap prices, one of the first hits on Google will be like, oh, put your information here and we'll give you a quote. So you start filling it in, you put in your zip code, which makes sense. They take you to the next screen. All right, put in your age. Like, okay, I'll put that in. Then they ask for your phone number. You start questioning a little bit, like, should I put that in? Should I not? But maybe you do it anyways. You put your email in, thinking you're going to get a quote, and then you hit go. And then you get a screen say, okay, someone will reach out to you. Really what you've just done is they're selling that, whoever's that site is, they're selling your information to a bunch of agents like us. And you're going to get called relentlessly to try to sign up for whatever the supplement is. What we've done on our website is we've provided a spot where you can go on. You don't have to give us any of your information. You put it in your zip code, your age, and it will show you what the actual prices are without us even knowing who you are. So there's no way for us to contact you. We're not going to call you. But if you're just trying to look to see what the prices are, you absolutely can go there, do your research. Now, a little bit is how we our business model is we do sign people up. We earn a commission from the insurance company. So we would ask that if we help provide service, then call us and we can help you sign up. But you're not going to get calls from us if it's not warranted, like if you haven't asked for it. So I'm going to show you on our website how to run these quotes. If you go to cardinalguide.com, this is the front page of our website. Up here at the top, we have different tabs, but what we're looking for is the 7 worries. So if you've watched our channel, if you've seen other videos, we talk about 7 sort of main areas of retirement that people are worried about. And you're going to go down to the Medicare tab. It's going to take you to the page. It's got a lot of resources about Medicare, but what we're looking for is this right in the middle of the page where it says start free comparison. So I'm just going to run an example to show you how it works. Obviously, if you're in a different zip code, if your age is different, if you're male or female, you'll have to put in your own information. But I'm going to run it at our office zip code 27713. Let's assume you're turning 65, you're just getting on Medicare, and that we'll do a male price. Non-tobacco, we hit run comparison. So it's going to take you to a screen. It's thinking about it. It's pulling up the quotes. But again, one of the things to know, and Hans had mentioned this, is these plans are standardized. So a G plan is a G plan is a G plan. It does not matter who you get it from. The coverage is identical. The only difference is going to be the price. And again, when this pulls up, you'll see what this is looking at here. Now, I will make another point here. The prices we look at here, they do not include any discounts, right? If you're married, some of these companies will offer household discounts. It could be less. Some companies want you both to sign up. Some companies, only one of you need to sign up. So you might actually have a little bit lower cost here. If you're a female, the prices will be less too. They charge a little bit more for men. But a G plan for a 65-year-old here in Durham, North Carolina, Medico is offering it for $124 a month. If we scroll down some, so let's just go down here. Let's see, Guaranteed Trust Life, $251 a month for the same thing. Some of these are rated prices. So again, if you're turning 65, you wouldn't have to pay the rated price here. But again, Cigna 142, New Era 141. I mean, it gives you the full list of what the options are there. So go to our website if you're looking for an end plan, right? Maybe you've seen some videos, you want to look at an end plan. You just change the plan name. We're going to look at an end plan. It's going to rerun the quote. We're looking for monthly here. And again, same with a G plan. An end plan is an end plan is an end plan. Does not matter who you get it from. And you can sort of see the prices there. So if you're just signing up, you're trying to do a little bit of research, get your sort of head around the price that you're going to face once you get to Medicare, I would encourage you to use the site. It gives you the real quotes of what the prices would be. And again, you didn't have to put in your name, your phone number, email. There's no way that we would contact you unless you reach out separately and ask us to help you sign up for the plan.
Okay, so what I want to summarize is where does this stuff apply specifically to high income people? I mean, and before you if you or your spouse is still working and the group is 20 or more, you want to consider delaying Medicare. I didn't say delay Medicare, consider it. If you need Medicare and you've got some other solution, but it's not group insurance from active work, you're going to need to sign up for Medicare. And that's the point. And high income people, a lot of them are working longer, staying in their job. And as long as you're working there and you're satisfied with the group insurance for you and your spouse, you can delay this decision. And then I guess you don't need to learn the rest of this. Then your next thing that you're going to need to deal with is when you sign up for Medicare, and you're going to do that on Social Security's website at ssa.gov, which you probably need to get in there, maybe you already have, and get your Social Security statement that way, because we can help you with some planning on that. But that's where you sign up for Medicare, and you tell them, okay, so I turned 65, in July, so I want to go in there, and I want to tell them starting in July, I want Part A and Part B. And then the next thing you need to concern yourself with is this IRMAA. And IRMAA stands for Income Related Monthly Adjustment Amount. You can Google this topic, IRMAA, that acronym, and you're going to get a whole bunch of showing you. This could be as much as $700 a month that you're going to be paying for Medicare as opposed to $185. So you need to pay attention to this. There's also ways to appeal it. Not going to get into that on this video, but we can help you with that. So you can appeal IRMAA. But so you're going to need to decide, am I going on original Medicare, or am I going to take my original Medicare and go for one of these Medicare Advantage plans? And I think the biggest stop sign to that is this managed care piece. Like if you're going to be limited to the doctors and hospitals that take the plan. And for high income people, high net worth people, is if you want the options to go to any doctor that takes Medicare anywhere in the country, and if you want that option, or even with your own city, the specialist in whatever disease you have may be at the place across town or in the next city. When you're on original Medicare plus a supplement, you can go to anybody that takes Medicare. When you're over here, you're in that plan for the rest of the year, and you're going to need to go with what they tell you to do. So that's a point of alert. And then if you stay here, you're going to need to buy a supplement. And it really, by the time I've gone through all of this, getting into the details of trying to save a few bucks on the supplement is wonderful. And we'll help you do it. And we're going to get you to the best price we possibly can with a good quality company. That's not the major issue this for high income people signing up. So we want to give you a way to do your research on our website. I wanted to throw on also that if you're going to need dental and vision, you're not going to get that thrown into your Medicare supplement because Medicare doesn't cover that, but you can buy a private policy for dental and vision. We sell those. We're in all 50 states and DC. And both Tom and I are CFPs, and we do certified financial planners, and we do Medicare consulting because it's so important for people in retiring. And it's also a good way to draw people in to our financial planning practice through the Medicare consulting. So, and I think if you're a high income, you need it. So I was going to add on a couple other points that at this point in your life you need to look at is if you don't have long-term care insurance, you need to investigate that. And beyond investigate it, you need to do something about it while you're still in good enough health to qualify. And then I also wanted to talk about Social Security timing because that's an issue. People that are turning 65 now, their full retirement age is 67. They can take their Social Security at 65, they're going to get less. If they wait till 67, they're going to get that right amount. If they wait till 70, they're going to get substantially more. No one decision is right for everybody. So that's a part of our practice that we specialize in. So we do Medicare consulting, and then that leads into, it's purely optional, comprehensive financial planning, retirement planning, which is going to cover Social Security, Medicare. It's going to cover long-term care, go over some options. Even if you're not in good health, we have some options for you. You need a distribution plan for your 401k and IRA. Many of you are on the government's plan. You're just going to wait till the government makes you take money at 73. We think there's some better options. We'll show those to you. You're going to need to create a retirement income when your check from work stops. Estate planning, everybody needs that. Is how's your money and stuff going to transfer first to your spouse effectively and then to the next generation. And then tax planning is a function of trying to save you some money on taxes over the whole of your retirement. So I'm Hans Scheil.
And I'm Tom Griffith.
And we thank you very much for listening.
Thank you.